Hi, I'm Saul Marcus Naturopathic Doctor. This is the first in a series of short videos on interpreting thyroid labs. I'm not going to cover everything. Rather, the focus will be on the basics that's relevant to the great majority of people. I'm especially going to focus on important findings that medical doctors typically dismiss as normal. Really, before we even look at anything, the first rule to know about interpreting thyroid labs is just because your medical doctor says everything is normal, that does not mean everything is really normal. All the time, clients tell me that their MD said their labs are fine, but then after we go over them, it's clear that things are not really fine. In conventional medicine, the reference range for TSH is going to be about 0.4 to 4.0. Now, it might be a little bit different depending upon each lab, but it's generally going to be in that range. And that range is way too large in both directions. Really, the TSH should be about 2.0. But where things get tricky is that normal TSH is different in everyone. In one person, it might be 2.0, in someone else, it might be 1.5, in someone else, it might be 2.5. There is no hard set rule. However, when TSH starts to go down under 2.0, that indicates that there might be a problem, and especially when it gets into the lower ones and under 1.0. Your medical doctor may think that a TSH above the official low point of 0.4 but under 1.0 is healthy. But really, it's not. It's in the reference range. It might even be called normal, but it's not optimal and it's not healthy, especially if you see a TSH of like 0.8 or 0.7 and starts to get even lower. You have to really start looking deeper into the cause of this. There are two main causes of declining TSH that I'm going to cover. The first is hyperthyroidism, which is typically caused by an autoimmune disease called Graves' disease. The other is low pituitary or hypothalamus function, and this is very poorly understood in both the worlds of conventional medicine and natural health. To quickly review some basics, the TSH, although it's the most common thyroid lab run by medical doctors, it's not really produced by the thyroid gland at all. It's actually made by the pituitary gland. Now, these two glands in the brain, the hypothalamus and pituitary, they sense how much thyroid hormone we have circulating. And if we have a lot of thyroid hormone, then those parts of the brain say, hey, we have enough thyroid hormone, we don't need to make more. So they send a signal to make less TSH, and by making less TSH, there's less of a signal to the thyroid gland to make thyroid hormone. And that's why, typically speaking, low TSH is associated with high thyroid hormone, and you have to think about high thyroid hormone or hyperthyroidism when there is low TSH. There are a couple of other causes, but generally speaking, hyperthyroidism is caused by an autoimmune condition called Graves' disease. The textbook case has some pretty severe symptoms. There can be a goiter around the thyroid, swelling around the thyroid, protruding eyes, mixed edema, which is edema and discoloration of the skin over the tibia, sweating, tremors, hyperactivity, heart palpitations, hair loss. And this can become very serious. It can be fatal. People can go into what's called a thyroid storm. So this is a very severe, dangerous condition to have. And that's what medical doctors are trained to look for. However, it's not always that severe. In fact, someone could have hyperthyroidism without even having all of these symptoms present. And some of these other symptoms include high blood sugar, anxiety, which I put in quotes because anxiety is a pretty vague term, digestive issues, diarrhea, other things going on in the GI tract. So if these things suddenly occur or start to occur slowly over time, and TSH is always on the low side, it's not a bad idea to test for the antibody to see if Graves' disease is going on. And that test is going to be TSI, or thyroid stimulating immunoglobulin. It also sometimes goes by the name of TSH receptor antibody, which is confusing that it has two names. That's just the way it is in the world of medicine. However, this should be a consideration when TSH is low. And unfortunately, a lot of times it's not, and this condition could go on lingering undiagnosed. The next cause of low TSH, which is an underfunctioning hypothalamus and or pituitary gland, is not something that's well known or understood when it really should be. Now, we need to remember that in sick people, the body may want to make less thyroid hormone as a self-protective mechanism. Now, let me explain that. It's typically known that in, say, starvation, if you stop eating, then the body is going to lower the metabolic rate as a self-protective mechanism. And how does the body lower its metabolic rate? Well, it does that by lowering thyroid hormone. You will also see this in medical crises, where this is called euthyroid sick syndrome. Now, medical doctors know that if you go into a hospital and if you look at people in critical care, you look at people after they get surgery and so on, you're going to see a lot of low thyroid hormone on labs, and they know not to treat that because that's called euthyroid sick syndrome, which is a very confusing term. It really means normal thyroid sick syndrome, where if the body is under a lot of stress as a self-protective mechanism, it lowers the amount of thyroid hormone. And that's because if you're in a catabolic state, catabolic means that your body is wearing down or breaking down. The faster your metabolic rate, the faster your body is going to wear down. So therefore, the body wants to lower thyroid hormone in those situations. Sure, it's not a way of feeling better. You're not going to feel better with less thyroid hormone, but nonetheless, it's the body's way of protecting itself. Now, where it comes in, where conventional medicine and a lot of times in natural health, they just kind of miss the point, is that this does not just happen in starvation and medical crises. It happens in chronic illness. If someone is chronically ill, sick, has a lot of inflammation, a lot of chronic degenerative conditions that we typically see in the world today, the body is going to do the same thing. It's going to lower TSH as a self-protective mechanism. So here's a quote from the medical literature about this. It's a little complicated, but it says at the end that lowering T3 might be of beneficial adaptation during starvation and illness to conserve energy and substrates and minimize excessive tissue catabolism. In lay language, this basically means that the body is breaking down. It will lower the metabolic rate to protect itself. So going back to this basic chart, we can see that the pituitary in the base of the brain, that releases TSH, and that tells the thyroid gland how much hormone to make. We're not supposed to have a set fixed amount of thyroid hormone. How much thyroid hormone we have is variable depending upon many factors, especially the state of our health, and if we're in an anabolic or building mode, or if we're in a catabolic mode, what type of stress levels are we under. This is variable, and that's why the brain has these control mechanisms to tell the thyroid glands how much thyroid hormone to make. And this notion that everyone should have the same amount of thyroid hormone, or everyone should have high enough thyroid hormone to feel really good, it really doesn't work in with what the body is trying to do from a holistic point of view. Are there some people who have hypothyroidism because their TSH is low? Yes, absolutely. But that does not mean that we have to reflexively give all these people thyroid hormone. We need to first step back and think, why is the body inducing this stage of hypothyroidism? So this slide outlines, my basic thought process when someone has hypothyroidism, or it's called subclinical hypothyroidism, and low TSH on labs. And there are many people out there, and they're probably aware of it, where they have all the symptoms of hypothyroidism. You go online, you look at the websites, you look at the symptoms, you look at what you have, it's hypothyroidism, and then you go to your medical doctor and you have the labs run, and the TSH is like 0.9 or 1.2, and the doctor says, no, that's fine. It's nowhere near hypothyroidism. Well, no, it is hypothyroidism because it's being induced by low TSH. So in the case of hypothyroidism, or sometimes called subclinical hypothyroidism, which is caused by a functional problem of TSH. And I say functional because I'm not talking about a more rare like pituitary problem, such as a pituitary tumor, which is the type of thing that an endocrinologist might be concerned about. I'm talking about a functional problem, not a disease state. But the pituitary is not making enough TSH. That does not mean you need to run out and get Synthroid, Armathyroid, Natrothyroid, or some type of thyroid hormone drug and take that for the rest of your life. There are other things to do before going to that step. First thing is perhaps the pituitary and hypothalamus glands need to be supported, and there are supplements that can do that. You also need to take a full history for stress. Is there mental stress, psychological stress, also physiological stress, because stress is any extra additional demand on the body. Pain, starvation or not eating enough, stealth infections, improper exercise, blood sugar disorders, inflammation. What about environmental toxicity and metals and things like that? And adrenal dysfunction. The adrenals are very important. They produce the body's major stress hormone, cortisol, and cortisol has a profound effect on the rest of the body. If there's an issue with stress and adrenal deregulation and cortisol levels are off, you want to get that corrected as well, because that's going to adversely affect the thyroid and the pituitary in terms of getting this whole thyroid mechanism working properly. And I will restate that you do not want to blindly take a T3, T4 thyroid hormone product such as Armour Thyroid or Nature-Throid, and in a way which works against the body. If there is a functional problem going on which is causing the body to want to have less thyroid hormone as a self-protective mechanism, is it really then the wisest thing to start taking more thyroid hormone? Not only are you working against the body and pushing a catabolic state. By catabolic, I mean you're pushing the state where the body is breaking down excessively. But in this situation, there's no real thyroid problem per se. It's just that all these other functional problems are causing the body to not want to make thyroid hormone. So it doesn't mean that you need to take thyroid hormone the rest of your life. And my concern is that with a lot of people pushing, Armour Thyroid and Nature-Throid and talking about everyone having hypothyroidism, well, it's true that they have hypothyroidism, but we want to look at this from a truly holistic perspective. Now, I'm definitely not ruling out the need in certain circumstances for people to take a Synthroid, Armour, or Nature-Throid medication. However, the whole picture should be considered. Remember, the thyroid does not decide to stop working for no reason. And hypothyroidism is not a disease of a deficiency of Armour Thyroid. And there's a lot of really well-meaning people out there who are talking about underdiagnosed hypothyroidism, saying that you need to go by symptoms, and then they promote this notion that everyone should go by symptoms and then just take thyroid medications without looking at labs. In fact, there are a lot of people saying that the labs are worthless. What I'm saying is, well, you need to consider the symptoms, yes, but the labs are not worthless. The labs are actually telling you a lot about the underlying physiology, and we want to understand that there are different patterns of hypothyroidism. There's a low TSH pattern, there's a high TSH pattern, there's other patterns of lack of conversion that I'm going to get into in later videos. And once we understand these different patterns, and we understand that not everyone with hypothyroidism symptoms has the exact same pattern, then we can intervene in a way that makes sense in terms of the underlying physiology of the body and working with the body and what the body wants to do. And if the body wants to lower TSH as a self-protective mechanism, I really have to question the wisdom of then treating such hypothyroidism with hypothyroidism drugs as the primary intervention. If possible, intervention should be towards self-regulated healing and not assume dependency of medication for life. Because if I see hypothyroidism symptoms and that low TSH, my goal is to remove that stress, do some things to get the pituitary and hypothalamus start working again, and see the TSH and thyroid hormone go up on their own. And in the long run, that person is going to feel a lot better not being dependent on medications. So in my next video in this series, I'm going to discuss high TSH, and then there's going to be further videos on free and total T4, T3, and then finally on the antibodies, the thyroid peroxidase, thyroid stimulating immunoglobulin, and the other antibody tests, because those are often not run by medical doctors when they should be. If anyone has any questions about any of this, then just send me an email through my website and I'll get back to you. And that's it for now. Bye.